Good morning, Ms. Robinson. How are you?
Good, how are you?
I'm okay, thank you. My name is Julie. I'm an F&P student with United States University, and I'm going to be doing your health history interview today.
Okay.
I'm recording this for my professor at my local school, and also it's going to be uploaded to YouTube, and I need to know if you can give consent by saying your first and last name, and I consent.
Katie Robinson, I consent.
Anytime during the interview, if you have any questions that you want to ask me, you are more than welcome to ask. The process should take about 15 to 20 minutes, okay? Why did you come to see us today? What brought you here?
Just for an annual checkup.
Okay. When was your last checkup?
April of last year.
Are you taking any medications?
I take Trilose Sprintec, birth control, and a multivitamin, and sometimes I take vitamin D.
How often do you take the birth control?
Every night.
Have you had any problems when you've been taking those?
No.
How often do you take the multivitamin?
Once a day, if I remember.
And the vitamin D?
Once a day as well.
Are you taking any over-the-counter medicines besides the vitamin?
No.
Are you allergic to any medicines?
Not that I know of.
Are you allergic to any foods?
No. Mussels make me vomit, but if I drink sparkling water, then it's okay.
And you said it's resolved by drinking sparkling water?
Yes.
When the last time you had mussels?
It's been a couple years.
Are you allergic to any animals such as cats or dogs?
No.
Are you allergic to latex
No.
or peanuts?
No.
Okay. And you mentioned that you had your last physical last April. I'm going to ask you some questions about your dental. When was the last time you had a dental appointment?
Last July.
Did you have any problems with it?
No.
Are you up to date on all your immunizations?
I believe so.
Have you had the flu shot or the pneumonia shot?
I've had the flu shot.
When was your last flu shot?
This past August.
Do you exercise?
I try to go to the gym 3 times a week if I can.
When was the last time you went to the gym?
On Sunday.
Congratulations on that. I know sometimes that's hard for people.
It is.
Do you eat regular meals?
I try to. Sometimes I don't if I'm at work.
Where do you work?
I'm a nurse at Piedmont Fayette Hospital
How long have you been there?
for 3 years now.
What type of work do you do?
I work on a med-surg and neuro unit, and I'm in staffing, and sometimes I'm charged.
That sounds like a busy workload. Are you able at times to take you a snack or get you a granola bar or anything when you
I
don't
try
have
to,
meals?
so I usually have a snack bag.
But sometimes you just can't get a full meal.
Yeah.
Have you had the HPV vaccination?
Yes.
What age did you get that?
I think I was 19.
Do you wear your seatbelt?
Yes.
Well, good. You wear it every time?
Yeah.
Oh, good. Okay. Do you have any guns? And if you so, are they in a lockbox?
I don't have any guns.
No guns. Okay. I'm going to ask you some family history. It's going to be regarding your parents, your grandparents,
Okay.
maybe your siblings and uncle or aunt. Okay. Do you, is your mother still living?
Yes.
Does she have any health problems?
Just hypertension and high cholesterol.
What is her age?
55.
Now tell me about your father. Do you have any health problems?
He passed away, but he had sarcoidosis, prostate cancer, hypertension, and high cholesterol.
Did he die from any of the illnesses?
No. He died from a car accident.
I'm sorry to hear about that.
Thank you.
I'm going to ask you some questions regarding your maternal grandmother and grandfather. Do they have any health? Do your grandmother have any health problems?
They're both deceased. My maternal grandmother had breast cancer, and I don't believe my maternal grandfather had any health issues.
Do you know how old they were when they died?
I don't.
I'm sorry about your grandparents. Your paternal grandmother, does she have any health problems?
She had type 2 diabetes, DVTs, and I believe hypertension.
Is she still living?
No,
How old was she when she died?
I think she was in her 70s.
What did she die from?
Complications due to the DVTs.
And your paternal grandfather?
I'm not sure of his medical history.
Do you have an uncle that have any health problems?
Not that I know of.
Any aunts that have any health problems?
Just hypertension and high cholesterol.
With high cholesterol and hypertension running in your family, have you ever had your cholesterol checked?
I have, and mine was slightly elevated, but they just recommended diet changes.
So they recommended diet changes. Has that been working for you?
I believe so, but I haven't gone to have it rechecked.
Okay. We probably can check that for you if you would like at the
Sure.
clinic. Okay. Are you married?
No, but I do have a fiance.
Okay, congratulations.
Thank you.
Any plans soon for the wedding?
We have not set a date yet.
Are you still living at home or do you have your own place?
I have my own place, an apartment for about 3 years now.
Okay. Do you have a good support system?
Yes, I do have close family and close friends,
Okay.
and my fiance.
Okay. What do you do for fun?
I like to go hiking, and I hang out with my friends if our schedules match up.
What do you do to release stress?
I meditate, I pray, I listen to music, I go hiking or go outside. Sometimes I work out.
Do you drink water?
Yes. Lots of water and lots of tea.
So You say you go outside, you walk around, you hike. Does that help relieve your stress?
Yes.
Do you drink alcohol?
Socially, maybe once a month, I may have a glass or two of wine.
Do you drink? Do you smoke?
No.
Do you do drugs?
No.
Have you ever done drugs or ever smoked?
No.
Do you have friends that smoke?
No.
Do you have friends that do drugs?
No.
We're good. You got some good friends. Good friends. Okay, right now I'm going to be asking you some different questions regarding the different systems in your body, such as your head, your chest, your legs. Throughout the process, I will let you know the different questions, okay? Do you have any problems with night sweats?
No.
How's your sleep pattern?
I usually can sleep through the night. I probably sleep about 6 to 7 hours.
What time do you normally go to bed?
Somewhere between 10 and 11 p.m.
Have you had any depression?
I have been more sad since my dad passed away.
Yeah, I can understand that having a toll on your body and on your mental status. Are you seeking any counseling at this time?
I've looked into it, but I haven't gone to a class. But I do have my books on grief and my journal, and I listen to meditations, and that seems to help for now.
I can also give you some information on the different counseling centers, just in case you decide that you need it more than you
That'd be
right
great.
now, okay?
Thank you.
Have you ever had any suicidal thoughts?
No.
Do you hear voices?
No.
Any mental illness run in your family?
Not that I know of.
Have you had any new anxiety lately?
I have, just related to getting back into my normal patterns and with school.
Oh, you're in school?
Yeah.
Congratulations. What are you studying?
Studying nursing again.
You are? Okay. How long do you have left?
Less than a year.
Well, congratulations. Do you have any ear problems?
No.
Any pain?
No.
Ringing?
No.
Any drainage?
No.
Do you have any nose problems?
No.
Any stuffiness?
No, just occasional sinuses.
When you say occasional sinuses, what kind of problems would you have?
Just stuffiness and a runny nose and sneezing.
What type of treatment do you use when you're having those symptoms?
Sometimes I take Flonase.
Is that a prescription?
No, just over the counter.
Is there a certain time of year that you have to use it, or do you use it throughout the year?
Usually just in the spring, but this year I used it in the fall as well.
How many, is it two? Is it dosage?
I'm not sure, but I usually do one puff in each nasal, in each nail. Just once a day.
Okay. Do you have any problems with your vision?
No.
Do you wear contacts or glasses?
No.
Any itching?
No.
redness,
No.
any crusting,
No.
any drainage.
No.
Do you have any problems with your mouth, such as dry mouth,
No.
swallowing,
No.
any jaw pain?
No.
And you said, when was the last time you had your dental?
I believe last July.
Last July. Okay. Were there any problems when you had your last appointment?
No.
Are you already scheduled for your next dental appointment?
No, but I need to.
Okay. Yeah, because we want to stay on top of those nice, pretty teeth you have. Do you have any neck problems?
No.
Any pain in your neck?
No.
Any pain with swallowing?
No.
Any swollen lymph nodes?
No.
Any sore throat?
No.
Have you had any problems with breathing?
No.
Any coughing?
No.
Any wheezing?
No.
If you take a deep breath, do you have any pain?
No.
Have you had any chest pain?
No.
Any irregular heartbeat?
No.
Have you ever been told that you had a murmur?
No.
Have you had any swelling?
No.
Okay. Have you had any problems with your bowels?
No.
When was your last bowel movement?
This morning.
Any nausea or vomiting?
No.
Have you had any problems with going to the bathroom with urination?
No, but I did have a UTI about a month ago that resolved.
Did it resolve on its own, and you had to go to the doctor?
I had to go to the doctor, and I had antibiotics for a week.
I noticed you said that you had a fiance. How long have you all been together?
4 years.
Have you ever been tested for STDs?
Yes.
Any problems with that?
No. All negative.
Okay. Have you ever been pregnant?
No.
Have you ever had any problems with your menstrual?
Not currently. I just had heavy periods, which is why I started birth control, which I've been on for about 7 years, maybe.
Have you ever been tested for any blood clots or anything like that?
No.
Okay. What about blood pressure? When you go back, do they check your blood pressure?
Yes.
Has everything been good?
Yes.
Okay. Because the reason why I ask because birth control does pose a risk for blood clots, and sometimes it will cause your blood pressure to go up. So if you start to have any swelling in your legs or pain in your legs or any chest pain, please get it checked out. Also, if you start to have blurred vision, dizziness, or headaches, to have that evaluated also, okay? Do you do breast exams?
Yes.
How often do you do the breast exams?
Once a month.
Have you noticed any lumps,
No.
any bumps,
No.
any drainage,
No.
any discoloration of your nipples?
No.
Right now, I know you're looking at your chart. You're not old enough to have a mammogram, but just know as you become older, there will be a time when you have to have a mammogram. Usually it happens around, I think, 35, okay? Have you had any muscle pain?
No.
Any joint pain?
No.
Muscle weakness?
No.
Okay. Do you have any limbs that you can't move properly?
No.
Have you ever had any dizziness?
No.
Any lightheadedness?
No.
Have you ever been diagnosed with vertigo?
No.
Any numbness or tingling in either limb?
No.
Okay. Have you had any problems with acne?
Just when I'm stressed.
What do you use for your acne when you're stressed?
I put tea tree oil, just topically to spot treat.
When was the last time you had to use that?
Maybe yesterday.
Do you have any problems with your nails breaking?
No.
Any discoloration?
No.
Okay. Any dry skin or
No.
any rashes? Do you use sunscreen when you're outside?
Yes.
Okay. Do you have anemia?
No.
Any bruising?
No.
And I know you mentioned that you had heavy periods. Are they much better now, or do you still have those?
It's much better now. It's usually between 5 and 7 days, but not as heavy.
Have you ever been diagnosed with thyroid problems?
No.
Diabetes?
No.
Have you ever had, do you have increased thirst,
No.
increased hunger,
No.
increased urination?
No.
Right. Your vital signs today were pretty good. Your blood pressure was 120/60. Your temperature was 97.6. Your heart rate was 60. That's good. So I can tell that you're going to the gym and it's working for you. Your respirations were 20. So this completes the history assessment. Do you have any questions?
No, I don't think so.
Any concerns?
No.
Okay, and I will get the information that I said I will get for you and to see what we can go from here.
Okay.
If you have any other questions and if you need us, I will give you my card
Thank you.
and you can call us, call the clinic, and someone will contact you to assist you in your concerns, okay?
Thank you.
Nice meeting you.
You too.